E abbiamo come rappresentante del Co.As.It non Lina Scalfino, Presidente, ma Melanie Howard. Buon pomeriggio. Melanie, thank you for coming on to Radio Italia Una Adelaide representing Co.As.It SA.
Thank you for having me.
So you're a board member, I understand, of Co.As.It. So tell us, how long have you been on the board?
I'm a newly appointed board member. I have been working with Co.As.It for over a year now, just helping them with some of the operational side of the business, and then got an opportunity to work on the board. So I've been to 3 meetings, but know a lot about Co.As.It here in South Australia and also nationally. And so I've had some time on the board and really enjoying my time there.
Yes, and as you said, you've been helping with their programs and their initiatives to do with aged care. There are quite some changes about to occur. They were supposed to occur in July, but the government decided to delay them. First of all, when are these changes occurring, and how important, how big are they?
There are a lot of changes happening. So after the Aged Care Royal Commission, there were some key strategies that have come out. So the reform in aged care is in different settings of aged care. So it's been in the home care setting and residential setting. And I suppose what is good to talk about is yes, it has been delayed, as you mentioned. It was supposed to start in July. It's been postponed to November. So we're hoping that it will go ahead in November. So we can't be sure, but we're doing all the things that we can to be ready for that date. And I suppose the significant information and what older people should know about that is the government is changing the aged care to make it more about the older people. So we want aged care to be the centre for them, and so their dignity and choices and their respect is clearly shown. So for an example, a service provider would come and talk to someone and ask them about what they needed, and would explain what's available, and let them have a choice. So previously there's been some providers that would go out and talk to people about what they offer, but just, I suppose you could say, not enforcing, but thinks that they know what the person wants. But really, when you're talking to people, they've always got a story, and it's nice to know someone's story, and it's nice to be able to help them plan for the next sort of stage in life and what they might need. So the government's calling that the rights-based aged care system. So the other thing about that is that people tend not to make any waves or give feedback that's not so positive, and the government's saying this is what we want. So if you're not happy with your service, or you want some changes, or there's something like a service that you really want and you've been told no, that we really want you to come forward and start saying, well, this is what I want to do. So, if you wanted a shower every day, and the service provider thought you should only need 3 showers a week because you're not doing any activity, then the client would be able to say, well, my choice is to have a shower every day, and that's what I expect, and that's what I'd want you to provide. So that's one of the changes.
So this is, you said it's a rights-based approach.
Rights-based.
So it's putting the individual, the client, if you want to use this word, at the centre, and giving them the more decision-making authority.
That's right. They call it person-centred care, if people have heard that term before.
Person-centred care. Nice.
Yeah, person-centred care. So it's all about the person rather than about the person making the assessment about them and making assumptions, really. Having conversations about their needs rather than what we can, as a service provider, what we could do for you. It's what you telling us what you need, which is hard for some people, because with government-funded programs, the government are saying that we would like the person or the client to say what their goal is. And, I don't know about you, but I don't always have a goal in life. So, I don't want to have a clean and tidy house for people when they visit. But that's what we're saying is we're going to try and help people identify what they need. And some of the questions that people ask is, what did you used to do that you don't do anymore? So,
Okay.
if you used to play the piano, but you don't anymore, it might be that you can still play the piano, but you play some of the songs a little bit slower, or, there's a different tempo this time. So we want to help people be independent. And the other phrase I really like is we want to do, things with people, not for people. So have them involved. So if, Mary can't cut up the vegetables, but she wants to make soup, then a worker might help them cut up the vegetables, but don't do anything else in the kitchen. So it's only like the small amount that someone might need help with. So that's
Okay,
all
it's
about
nice.
the
And
other
you,
people.
it's all about the other people and their decision
Rights.
making.
Yeah.
And you said not all providers accept that, are willing to do that, are capable of doing that.
They are, and so they probably haven't done it so well in the past. And it's when the government comes and does their assessment or their audits where they've said, "Look, we can't really see here that you've given a choice to this client, or you haven't let them express themselves." And so that's how they come and say, "Well, you can do that better."
Yeah. Okay. So how could we choose? I know, so I know I haven't done it personally, but I've heard from others that it can be difficult. There's lots of providers, and maybe everyone promises things, but how could we go about doing the research and knowing how to select?
Um, Yeah, so one of the things is always ask other people. So if
Yeah.
like if you've got um, any um, of your friends that their parents are getting some care, it's always good. Word of mouth is always the way to go sometimes. What My Aged Care does have for people that are tech savvy and that like to go on the internet and have a look, um, is have a look at the aged care providers. So there is a way to have a look at that on My Aged Care and look at 3 providers at the same time.
Okay.
And I think, what you'd say to someone is have a look at what the services you need now and in the future. There's some providers will just do some everyday living, so a shower and some transport. And then there's other service providers that have some allied health, so they might have some nurses and physios and OTs. So if that's something and you don't want to change service providers and you want to stay with the same one for the long term, you'd have a look at what the services are offered, what the ranges are in services now and in the future. And if they could tailor them to your needs. So I suppose having a look at what you need on an individual basis. So it might be, multicultural services. You might need an interpreter. Can they help you out there? Or if they've got dementia services for later, or support people with specific impairments, I suppose is what you would be looking for. And so the staff qualification. So
Hmm.
I think with the changes of the aged care, they're looking at the aged care standards and the Act to have the staff have to be qualified. And it'd be good to have a look at the training that the staff get, if that's something that you're interested in as a client or the family member might be. And if the staff are supervised. So what I mean by that is there's some staff that are used in disability and aged care where they're in a group and the client can access that platform that worker's on. So that's one way of accessing staff, or another way is the service provider has a range of staff, so they also help choose what staff member you might need. So if you wanted a male worker, then an organisation would see how many male workers they could get at what time. And I really think that some of the staff should be supervised. So if I was out at a client's home and I had an issue, I've got someone to ring all the time. That's always good to know. And like I said before, if that service provider could meet your needs. So if you need a nurse, they might be able to come to your house rather than you go to the GP for, say, wound dressing, something like that.
Yes.
Um, I suppose if you've called somebody, it's about your first impression. So if you've left a message and they haven't got back to you on that day, I'd be pretty surprised that their communication would be that good all around. And
yeah, communication is an important component. As you said, not all older people, especially people who have to deal with government, are willing or have experience or background in having their voices heard or expressing their voices. So the communication is at least as much in the listening from the other part, but also helping the
and also the words that they use, I think, is important. So people like to use the word elder. No, I don't like that word. I like older person or older people, or just people, or if you're meeting with someone and you're having a communication, you're having a meeting with someone and they're talking to your family member and not talking to the client. I think that's one impression that you might think, oh, they're not going to be listening to the client. So just if you like their language and their style and the way that they talk is another way. And if they give you the information clear enough, I think there's a lot of information in aged care that you need to understand. So not only about, who's going to come, or if you're going to go to a group, you need to know the time, what you're going to do, the activity, what happens there, the fees, that kind of thing. So yes, you're right. Communication's very, very important.
Yes. Yes. Now I have a short. Sorry.
Reputation is the other thing.
Reputation. Yes, we'll come back to that in a minute. We'll have a short break for some messages from our sponsors. Then we'll come back to speak to Melanie Howard, board member of Co.As.It South Australia. Yes, we just had a short message about some of the services that Co.As.It offers, and we'll come back to that in a minute. You started to talk about a reputation as maybe one criterion for choosing a provider for services. How would we do that?
So reputation, so other people, if they're using the service, you'll definitely find out if you start talking about aged care with people that you'll find out if there's some service providers out there with a good reputation. And the other thing that you can do if you want to go onto My Aged Care, you can have a look at some of the results of the service provider and their audits. So if they've met the aged care standards, you'll be able to see that online.
Yeah, so these are audits now that the government goes and checks the service providers, so nursing homes or other providers, once a year, twice a year?
So it varies.
It varies, okay.
Yeah, so it's generally the 3-year accreditation, they call that in residential, and they call it a quality review in home care. So this is also part of the changes that they're changing the Aged Care Act, and they're strengthening the current aged care standards. And so they come out and make sure that the providers are working to the aged care standards. So with the changes, they're going to make the regulations more robust, and there'll be an independent complaints commissioner. So if people aren't happy with the services or the treatment that they're receiving or their loved ones receiving, they can then raise that and get some answers or get some more communication in what they need to get the aged care services they're looking for.
Yeah, so anyway, there are a few good tips there in terms of seeking the reputation of the provider. So you can go online on My Aged Care and you see how the provider's been rated in their accreditation visits, or clearly word of mouth is very important, very strong, and very useful. Yes, we've been getting some suggestions lately from relatives who have had people looked after, say, for example, at the palliative care stage, which is a very tricky, very sensitive topic. Now,
I think if people don't give you feedback, then as a service provider, you don't know that you're doing the things that people don't like, or
Yeah.
where there needs improvement. So I would always encourage people, how hard it might be, because, you know, we are generally Australians that don't make comment on the negativity of things, or the things that we don't like. But we're, with this aged care changes, we're saying to people, we really want to know, because I think we can fix it, and we want to fix it.
Yeah, so that's a more positive approach to that feedback.
Definitely.
Now, so two things in the very few minutes we've got going. So Co.As.It, we know Co.As.It runs activities in several centres, and I've known personally of the Unley Mensa, for example, because my parents used to go there. They don't, for a couple of reasons, just they can't. What things are you doing and hoping to do?
Yes, so we do the groups at the moment. So the social groups are in partnership. So like you said, with Unley Mensa, we're holding groups, and there's another group at Theberton that we've got, and another group, I think, sort of in the northeast area. But what we're working hard to do, which is a newer sort of model, is set up our own groups. So really love anybody listening that if they wanted to start a new social group, that to contact us and let us know what sort of group they'd want to come to. We really want to see what's the clients want, rather than Co.As.It setting up a group and no one coming. So we're really seeking to find out what people want. And we're looking at more ways of how we can, if people can't get there, how we could get some transport there. So that's sort of the new way for Co.As.It, but we're also keeping what we've got with the social groups and partnerships, because we know that people have already got established groups, and you can go to as many groups as you like. You don't have to just stay in one group. You can join any social group that's happening.
So you're saying you're open to suggestions and requests. So really trying to see what the demand is out there in the community.
And the one thing about these groups, so if people are attending a group at the moment and they've registered already through My Aged Care, they've got no problems. It's the new people that want to come to a group, they need to register through My Aged Care, because they'll be receiving a subsidised service by the government. And that's why they need the My Aged Care. The government needs the information to ensure that they've done the right assessment and the person can attend the group.
And once you're registered with My Aged Care, then, as you said, you get a subsidy from the government. So the government pays part of the costs, or a substantial part of the costs, maybe, of the services that are being provided. Yeah.
So you can contact My Aged Care by going onto myagedcare.com.au on the website, or their phone number is 1800 227 475. And then the other thing that people might not know is that they have a place, it's where that you can go and make an appointment if you needed to talk to someone about aged care. So you can go to Services Australia. So I think I saw one at Marion, one at Norwood. There are a few around the place. So if you're not sure about aged care, and if you need some advice, you can book a time to visit Services Australia office.
And they should be able to arrange an interpreter too, if that's needed.
Definitely, yes. That's definitely available.
Important. Okay, so good to hear that you're looking to expand and set up your own programs somehow in various parts of the city or South Australia. Are you restricted to Adelaide?
We can do regional, but we haven't gone there just yet, but can't see why we can't. If the funding lets us go there, we could. Yes. And the other thing is people can set up a private group with us as well. So they don't have to go through My Aged Care, but they can come to a group and it can be privately funded by the clients.
Okay, but without getting government money then?
Yep.
That's correct. Okay, well that's an interesting concept too. But it's nice to hear that you're looking to expand and open to suggestions from the community at large. Okay, I think we have to go now.
All right.
We reached the time. Thanks. Nice to meet you, Melanie. And
You too, Antonio.
it's good to see that you've joined the board, and they're refreshing. That's one of the topics that I talk about, is how we get renewal, strategic and generational renewal in the association, especially Italian associations. It's not always easy, but it's good to see that Lena and Co are managing that with your entry into the board.
Lovely.
Thank you. So that's
Thank
it.
you.
Now, another little comment message from Co.As.It, about Co.As.It in Italian this time. Actually, a couple of points of that little message. You talked about lezioni di fitness. So you have fitness classes at different levels. And it mentioned volontariato. So you have volunteers helping you out. So, and I guess there's never enough volunteers to help.
About to say that. So anyone listening that wants to do some volunteer work, a big or small role, we're looking for volunteers, always looking for volunteers.
Yes, and then you also have that big event once a year where you recognise the work of volunteers in the community. So now again, thank you, and have a good weekend, Melanie, and we hope to have more conversations in the future.
Okay, ciao. Thank you.
Ciao.